Was there a vote and they decided they weren't going to come?
Okay, it is 2:30 and it is time for the February 27th study session, and I'll look to City Manager Mike Scragg, who I think is going to look over across to Debbie, but we'll start with you.
Sure. Opioids has been in the news for quite a while. There's been settlements. You may recall that we've come before you before in terms of a memo of understanding and participating in the state and the League of Kansas Municipalities' approach to settlement on some of the opioid cases. Debbie Pack has previously been involved with distribution of special alcohol tax funds in terms of a grant approach to that, and the money ends up in finance. So Debbie drew the short straw in terms of administering the opioid topic. So she has a good presentation to kind of give you some background, and then we can talk about how to proceed with the settlement funds that we've received, as well as ongoing funds we anticipate receiving going forward.
Thank you, Mike. Debbie Pack, Director of Finance, and yes, I did draw the short straw. But the reason I'm in this seat is because we are receiving settlement funds from these litigations, and so we have to come up with a way to spend that money appropriately and as it's determined through the laws and the settlements as they've been been settled. So basically today I'd like to take you through a little bit of the history of the opioid litigation, what Kansas has done in response to that litigation, kind of what the settlements are, how they're going to be distributed, some of the strategies that some of the litigation has set forth and some ideas that they've brought forth. Some options, what we use funds for in this regards now, and hopefully by the end of this we'll have some good conversation about how we can utilize these funds to best suit Salina and the citizens of the city of Salina. So we were here, I don't know, about 3 years ago to talk about the litigation itself. It's been going on since before 2015. The first settlement was with the state of Kentucky in 2015. It's a nationwide litigation basically against pharmaceutical distributors and producers of opioids. And the reason that this is happening is because opioids are a highly addictive medicine, and they activate a part of your brain that makes you want it more. It makes people want it more, so it's very highly addictive. And so there's been a lot of discussion about who's responsible for the addictions, and what responsibility the makers, the distributors, and all the people involved in that have in that. And a lot of it comes down to how they use it, how they produce it, how they market it, and things like that. So, like I said, this has been going on for many, many years, this litigation. Kansas jumped into the bandwagon as a part of a national litigation. What's happened is states and cities have taken lawsuits against these individual pharmacies or pharmaceutical companies, and then they decided maybe it would make more sense to do a class action lawsuit with more parties involved. That's what Kansas chose to do. They reached out to all of the cities, counties, and any other entity in the state of Kansas, asked us if we wanted to participate as a class action member, and we did so. We made that decision in November of 2019 when you passed a resolution to do that. At that point, the only thing we had to do to show that we were a party in this class action was say that we've spent $500 on something that had to do with the opioid substance abuse problem in the city. Then in 2021, the Kansas State Legislature passed House Bill 2079, which they call the Kansas Fights Addiction Act. And within that act, they set some requirements. They set some policy and requirements about where the money's going to go when it comes to the state of Kansas, how it's going to be distributed, who's going to hold it, what it can be spent on, and things like that. And out of that was determined that there was going to be a memorandum of understanding. The Kansas Attorney General was going to be the central repositor of the settlement funds from these litigations, and they were going to enter into an agreement with the Kansas League of Municipalities and also with the Association of Counties in order to have some representation on this board for all cities, counties, and the state. So they all had to sign a memorandum of understanding, And within that, and I provided that, I won't go through it, but within that, it kind of laid out what happens when these funds come in. So there's some, and they created 2 funds at the state level. So when the settlement comes in from these companies, 75% of it goes to the Kansas Fights Addiction Fund, which is the state portion, so the state gets 75%. 25% goes to the municipalities Fight Addiction Fund. And of that 25%, counties get 50% of that and cities get 50% of that. And that's all within the memorandum of understanding, how that's laid out, when it's going to be set aside and things like that. So some of the responsibilities within that MOU that fall to us as a political subdivision is that, one, we cannot reassign those funds, so we have to receive the funds directly. What we do with them is different. So I couldn't say I want the state to send my funds to CKF or to the Salina Regional Health or something like that. We as a city have to accept the funds, and then it's our responsibility to administer those funds. We have to segregate those funds so that we can report on them. We can, however, enter into contracts or grants with nonprofits, charities, or any other entity that would provide the service that falls under the requirements of the Memorandum of Understanding. The Memorandum of Understanding also defines what types of things the funds can be used on, and that is anything to prevent, reduce, treat, or mitigate the effects of substance abuse and addiction. And that includes law enforcement or any other way that can be produced. And that's very similar to funds that we have through special alcohol, as Mike said, or special gas tax, where they tell us what types of projects we can use that funding on. So that's nothing new in this situation. We also can reimburse ourselves for previous expenses if we have those for substance abuse mitigation, or if we were in litigation as a city or county with one of these entities directly, which we were not. It also allows us to pool our funds, which is important. We could pool our funds with Saline County or any other political subdivision, and we could cooperatively come up with a project or a plan to spend that funding. The other responsibility we'll have is to track and report. So how is our money spent? So when at the end of the year I have to report, this is the amount that we received, this is the amount we spent, and this is what we spent it on, so that there is some grant reporting type of responsibilities for us. The distribution within the MOU stated that the first distribution would come in June of 2022, and then after that it would be distributed annually sometime before April. We have received those, and I'll talk about that a little bit later, exactly when we got that and how much we got. First, like I said, first it goes to the state, and then the state separates it out, and then they'll send it to us. So that's pretty simple. The next slide, slide 7, is really I pulled this straight from the Memorandum of Understanding that shows you that to prevent, reduce, treat, and mitigate the effects of substance abuse. But I just wanted to quote that from that MOU, so that it was pretty self-explanatory what these can be used for as we have a conversation and talk about it. We have providers here that might have ideas and things like that. We need to make sure we're focused on what that allowable purpose is from the MOU. And that there's also some direction from each settlement. So this is not a very simplified process, because each settlement can have its own rules and have its own terms and have its own timelines. So it's going to get very complicated once we get more parties involved. But I think the baseline comes back to that MOU and what that says for us. That'll be our guide to how we utilize that. So when we were trying to determine whether we even qualified for these funds, we had a conversation with the police department, and one of the things they came up with was the use of Narcan, which is a drug, a medication that's used to reverse the side effects of overdoses, and it's commonly used to counter decreased breathing in an opioid overdose, and within 2 minutes when given intravenously, and within 5 minutes if injected into the muscle. So when we had this conversation, I went to the police department and the fire department. I said, and Mike asked, how much do we use? Is this a real problem for us? You know, whatever. The police department just recently implemented full use of Narcan with every officer. They did training. They were trained in 2021 on the use of that product. And they did get some of that product from Central Kansas Foundation, and they received that at no cost, and that's a nasal form. There's two forms of Narcan. I'm learning a lot about this. There's a nasal form, and then there's an IV form. So that they have the nasal form, and they do have that for all of their officers currently. The fire department has carried the IV solution of Narcan for over 30 years. And so they carry it on their ambulances and in their EMS supervisor vehicles. And as you can see on the graph on slide 9, in 2020 we used it 52 times, in 2021 64, in 2022 68, and already in 2023 6 times. That's a 30% increase from 2020 to 2022. It's 30% increase in the use of that product. The costs associated with Narcan from the fire department, the nasal is $93.75 per unit, and the IV is $35 a unit. And that is currently paid out of their operating medical supplies. And they can explain the difference and all that stuff if you are interested in that. So if we move on to kind of the settlements and what's been going on, like I said, this has been going on for a long time. The AG's office announced in July of 2022 that there had been 5 major settlements announced, which included $195 million to the state of Kansas over the next 18 years. Those 5 were basically the producers of that, and then there was a group of distributors, McKinsey and Associates. The state will get $4.8 million over 5 years. They've already paid $4.1 million, and they'll have 3 additional payments for $205,000. And I'm giving you this information because that helps you understand the complexity of not knowing what we're going to have in the future, because every one of these settlements is a little bit different. We got $4.1 million up front from them. We'll get $205,000 in 3 payments. I don't know when. It could be next year. It could be in 18 years.
And just to be clear, when you say we, you mean the state of Kansas.
The state, yes. The state, we, the state.
And do we know our percentage of that, or does that vary?
It varies, and it's based on, I can't tell you off the top of my head, but I might, as we go through this, I might have that, because I might have written that down. The next one is a Malincroft, and there's also some differences in the companies. So this particular company was in bankruptcy. So this adds another layer of complexity. If you know anything about bankruptcies, you submit your liabilities, and then you get put on a list of who's going to get paid out and who's not going to get paid out. So the uncertainty in the valuation of the bankruptcy is always going to be an issue when we're talking about some of these entities. For this particular one, they settled on $1 billion to all states, 745 or 5.9 to 8.4 million to Kansas over the next 1 to 8 years. But like I said, the uncertainty in a bankruptcy adds another layer of complexity to that particular one. The next of the 5 settlements was what they call the distributors, and those are truly the people that are out there distributing the money. Amerisource, Cardinal Health, and McKesson are the ones that they mention. This was a $21 billion settlement for all states, $150 million to the state of Kansas over 18 years. And they have more money earlier in their settlement than later. That's as much detail as we're getting. So the uncertainty is really high here. The next one is Janssen or Johnson & Johnson. It's a $5 billion to all states, $35 million to the state of Kansas over 10 years. It's basically the same as the distributors. but it says the vast majority will be paid out over the first 2 years of the settlement. So you can see we might get a lot of these funds up front, and then it might dwindle off, and it could go on for 18 years. The last of the 5 is Purdue Pharma, which is another bankruptcy case, $5 billion to all states, $40 million to the state of Kansas, paid between 10 to 18 years. There's a lot of uncertainty in this one because the appellate courts are related to the release of funds from the particular family that own this. And as time goes on, in the news, you'll be reading there's settlements happening all the time. In fact, since this statement back in July of 2022, the Attorney General put out a statement in January of 2023, and there's now 11 cases that have been settled for a total of $340 million to the state. And those include CVS, Walgreens, Walmart, on top of some of these other pharmaceutical companies and distributors, so that there's just a lot of people involved in these cases that make it really, really tough to be able to forecast, I guess is my message. So I guess some of the question that people ask, and this doesn't really affect us in the financing and how we're going to spend this money, but is there anything beyond the cash that these people are having to do to make sure that they're addressing the root of the problem? And yes, in a lot of these, they're required to make changes to their supply. They have to be able to identify suspicious orders. They have to have a clearinghouse for shipping to make sure that they're not duplicating shipping orders. So there are a lot of stricter rules and regulations around the opioid medications that are out there. As for J&J, Johnson & Johnson, they no longer market these, but they've had to agree to not reintroduce any opioid for 10 years, and they've also had to agree to allow their trial data from their opioids that they did sell. They had to allow that to be released to Yale for research so that they could figure out what's going on and why these things have become so addictive and causing problems on the substance abuse side. So the litigation continues throughout the country with other defendants that may lead to future settlements that we don't even have a clue what they are yet. I've not seen any list of total, here's everybody that's being sued or anything like that. So the distributions from the settlements, like I mentioned earlier, every settlement has a different term, it has a different payment schedule, it has different allowable expenses. There's 2 different types. There's bankruptcy versus settlement, which then you have a bankruptcy trustee involved. Settlements, can have more terms imposed on the state. There's just all kinds of things. And then there's payments. Payments can be either prepaid or accelerated. The defendants have that option to accelerate their payment. But this also leads to uncertainty in what's going to be happening. They also have what they call a balloon or a long tail payment, which is basically a long settlement period that they're allowed. And so when Mike and I were talking about this and how do we address this, it's hard for us to know that this is the amount of money we have today and we'll be getting this amount of money for the next 18 years. It's not there. So I reached out to the Kansas League of Municipalities, which is one of the members of that MOU, and basically they're saying the same thing. With the variables and the complexity of every settlement, it's very difficult to predict the distribution amounts and the terms, so we don't know how much or when we're going to get this funding. We could get it all in the next 5 years. It could take 18 years to get it, so it's very difficult. So that breaks it down to what is our distribution, what is our portion of that money. So there was a distribution in June of 2022. The city did not get their check. I don't know why, if it came and we didn't, I don't know what happened to it, but we did contact the state, or they contacted us and said, hey, you didn't cash this. So they did resend that to us. We've received it today. That's kind of appropriate. So we got that back in June of 2022. And then we got distributions in February, and that's where I was telling you the first one was going to be in June, and then the others would be prior to April of the following years. So the first real one was April of 2020, or February of 2023, which we received a little over $107,000. So to date, we've received $118,623.85 in these funds from those first 5 settlements. Now, the other 9 settlements that are coming, I'm unsure whether those will all be held till next April, or if there'll be some settlements, payments out, distributions out to municipalities. In reading the language of the MOU, I would anticipate it all comes in April, or next year when that one payment comes. I think it was just that one initial litigation that they sent out that special funding. So the real question is, what do you do with the money? And each settlement and bankruptcy can impose different limits on what we do with this funding. The Johnson & Johnson and distributors strategies, they list examples such as inpatient care, medication-assisted treatment, outpatient support groups, rehabilitation. That's under expanding access and treatment. For harm reduction, their examples are warm transfer programs, OD intervention training for first responders, Narcan is listed, diverting substance abuse disorder patients away from addiction, and we're also not seeing any deadline for the use of these funds. So we have a little window in a lot of these strategies that don't have an end date. One of the other things that brought this discussion up to the forefront was some correspondence that we recently received, and I apologize this wasn't attached, but it was the attachment that I left on your chairs there before the meeting. In 2022, we received a letter from several local providers regarding their interest in having an input in the use of these funds. They felt like they provide the service out there, they're close to the services, they know what's going on out there, and their ask was just to be in the conversation. They wanted to have some input into how we were going to utilize this funding to hopefully help the city of Salina utilize it as best as we could. And also in 2023, we received a letter from a company called Mirror Inc., and it appears to be a facility that provides substance abuse not training, but they're out of Newton. So we have received those 2 inquiries on kind of the use of these dollars and what the city of Salina is going to do with these dollars. So I guess this is the big question, the final slide on here. How does the city want to use these funds? You have to go back to the amounts could vary widely from year to year. We don't know how long it's going to last. We don't know how much we're going to get. I would anticipate next year we should get more than we got this year because we have 5 additional settlements in there. And like I said, there's just no way of knowing how much and when you're going to get it. It's a little bit different than special gas tax and special alcohol tax because you have a history of what that is and what that generates, so you kind of can have an idea of what the cycle of repetitiveness or the growth in that particular revenue source is. This one is not as it's volatile. It's not a given. It's not easy to predict. There are options, as Mike mentioned. We do treat special alcohol funds in a grant provider type situation where we put out an RFP to local organizations and give them the criteria, and then they submit an application, and you all decide how we're going to distribute those to those particular things. We could use it internally. I'm sure the fire department, the police department may have options. I mean, obviously the fire department is spending medication now. There's some other options within those departments for training or use of that funding as we go along. We have talked to Salina County, and we haven't broached the subject of pooling our funding, but we could broach them about pooling our funds and doing some joint awards so that we'd have more funds. I think, Mike, was their amount 80-some thousand? It was less than ours.
I don't recall the dollar amount, but I would say that I had a conversation with Phil Smith-Haynes, County Administrator, and I think there's certainly openness to having a conversation about some joint approach. When I had the conversation with him, much like us, it was a little premature to know how much funding was coming in, and they had not budgeted for any appreciable amount of funding in 2023. So I think they were kind of looking at it as, let's see how this plays out a little bit, and their focus may have been more on 2024 than 2023. So I certainly don't want to speak for him or the county, but did have that preliminary conversation. I certainly think there's an opportunity to work collaboratively in some fashion, and I think we certainly want to do that, just so we're not funding duplicative efforts or anything along those lines.
Is fentanyl considered an opioid? Would that, did abuse of that particular drug fall into this use as well?
Yes.
Yeah.
I have to look at,
Thank you. I mean,
it wasn't one that was
I'm
listed
thinking if we
specifically.
put our foot on the opioid abuse, then people should get better about abusing that. But
Right.
there's ongoing other challenges beyond reimbursing ourselves directly. It looks like we'll probably be offering this out on a
Right.
contract of some kind.
You know, it certainly can create some work for public safety, fire, and police, and it can create some expense. But I think with the dollars that we're talking about, it's far beyond what we might decide
But we could
if
hold
we
it
choose to reimburse
indefinitely if
ourselves.
we foresaw an ongoing future problem.
Right. I think one of the difficulties is, we can certainly spend in arrears, meaning we make sure we collect the money before we award it. But with the fluctuations that Mrs. Pack's talking about, one of my biggest concerns is an agency standing up a program based on a funding level that fluctuates widely from year to year. And I'm hopeful that as the settlements come in and there's a little bit more specificity, they will have a better sense of what that income stream might look like, so that it may go up with another settlement, but hopefully it wouldn't take a drastic downward turn too suddenly. But that's going to be one of the hardest things to manage in all this, I think.
Is there any speculation what the state will do with the 75% they hold?
I
Are
haven't
there
seen
going to
a
be
whole lot.
duplicate programs out
But
there?
yeah, that's a good
offered?
point. I can't say that I've seen a whole lot in terms of what they're intending. But yeah, that's certainly something to be factored in with the dollar amounts they're talking about. I would expect they'll be rolling out programs that could be helpful in our community as well.
It might be, and like I was going to suggest, we have several providers here in the audience that would love, I'm sure, to give you some more information that we even have that would better enable us to have a deeper conversation about this and probably answer your questions.
I have some thoughts, but one question. When paramedics administer Narcan, is that charged on their bill?
Yes.
Right, so you have a ballpark figure what percentage we're recouping money on? Not that the people you're giving it to necessarily have Blue Cross. A lot of them do, and you don't want to have that stereotype about who's using, because folks would be surprised when you look at who's using. But is a fair amount of that reimbursed?
Honestly, we'd probably have to have
Step to the microphone, please.
Shane Pearson, Deputy Chief, Fire Department. The reimbursement part, we would have to go through the billing process and see, run that report. That's one thing that, as far as data, that we didn't reach out and look at on this particular item. I agree with you, Commissioner Davis, the stereotyping of patients, but I can tell you that a lot of ours are probably not utilizing prescription type medications. Most of what we see are, at least on the EMS side of things, are from the illicit side of opioids, so illicit fentanyl, things of that nature. So a lot of those patients may not even have an address at times for us to submit any of that information to.
But besides usage, does the Narcan have an expiration date where it has to be discarded and then?
It does. Most of what we purchase when we get it new, 18 months roughly. Sometimes it depends on demand, obviously. We've had notifications from the medical suppliers that we utilize that, hey, the Narcan that you ordered is only going to be good for 10 months. Are you okay with that? And typically we're okay with that, and not often do we have to discard it for not being used.
So how often in the field is it IV versus nasal spray?
For us, almost 100%. Very rarely do we administer it nasally. The way that we carry Narcan is the medical grade in a syringe versus that is intended to be administered intravenously. There are devices that can be placed on the end of that syringe, similar to the nasal Narcan that the police officers and law enforcement carry. Administration would be very similar. For us, it atomizes the medication as you inject it into someone's nose, but most of ours is administered via IV, at least from the EMS side of things.
Do you have to get consent to administer it, or is the patient pretty well gone?
So we typically do not administer Narcan unless they are unresponsive. So when someone's unresponsive, we're allowed to follow implied consent, meaning that it's implied that they would want us to provide medical care to the best of our capabilities and to the extent of our capabilities while they're unresponsive. All right, thank you.
To answer your question, Mayor Hoppick, the percentage, I actually have a spreadsheet. It looks like the city of Salina gets a little over 2% of the state or the city funding. So 2% of the 25% that comes to the state.
As a follow-up, could I ask, you said that there could be pooling. Could Saline and the surrounding counties put their money together to have a program?
I
our region?
read it as that, yes, because it said any political subdivision.
And I think that would, for us, I think that would be a good thing to look at because, the medical catchment area for EMS does not stop at the city limit. Mm-hmm. And there's just as much drug abuse in the county as there is in the city. Mm-hmm. And I just, we'd have more money. You could stand up a larger, more comprehensive program if we pooled the money.
Because as I read this, it has to be used for the specific, and again, I think we look at the police and fire department, whether it's Narcan and they may have some other uses of these funds, but we probably have a limited dollar that we're really going to need for local. So I think then we're looking at probably some kind of a treatment, center, and I happen to see Shane Hudson sitting out here from CKF, and I know they deal with that. And I guess a question that made me think a little differently as we talk about pooling this. I guess I'd look at Mr. Hudson and ask how many people they treat from outside of Saline County. If we were to go out, if we're a regional, treatment center, whether it's them or it's the Salina, I know, Salina Family Health Care, if those people are treating too, would be something worth us looking into if we were to pool those dollars.
Yeah, my name is Shane Hudson. I'm the CEO at CKF Addiction Treatment here in Salina. We did in 2022, we served over 2,300 unique patients. That was up from 1,900 just a few years ago. We were actually on track to serve 3,000 unique patients. So those are individuals, not the number of services amongst those individuals in 2022. So the need is rising and rising and rising. The state block grant dollars are going out the door quickly because when you have the state targeted response and state opioid response dollars coming to Kansas initially through, I think it was 4 organizations, including CKF, and we were covering the western half of the state, including Saline County, and shifted now into this process where you get reimbursed through your regular billing mechanisms for patients who are below 200% poverty level and no insurance. As those dollars have shifted a certain way that they're not going to treatment as as often as they're going to medication, we then started serving more and more patients, and then the dollars dropped out the bottom. Because the state didn't get as many of those dollars this current year, October 1 forward, for the federal fiscal year, we have less dollars to serve patients, and we've gone through a lot of our state block grant dollars. So that pressure on communities, as I mentioned, this 2,300 patients, I think it was 2,345 that we served. We're now trying to do more with less dollars. I'd say, I'm trying to think of our data from last year, that 47% of our patients served across the state were from Saline County, but we're serving patients across the state because we don't have catchment areas. We have offices in McPherson, Salina, and Abilene. We offer telehealth services. We have partner clinics across the state and a couple of hospitals we serve. So a lot of patients are being served by our agency. Majority of those patients are coming from Saline County and surrounding areas. I can't define exactly as that core spreads and thins. But I will say when those dollars came to CKF as one of the 4 agencies in Kansas 6 years ago, we were able to purchase Narcan, provide Narcan training, provide Narcan to local agencies amongst our McPherson, Salina, and Abilene locations. Over time, that shifted to another agency in Kansas to disperse Narcan. There's not enough Narcan to go around. These gaps that are happening in care are that Narcan, the dollars ran out, and then there wasn't enough Narcan to go around. First responders need Narcan. I would even say, forget making that a competitive grant process. Just make sure that our local first responders have Narcan available and save lives. That point of contact to save lives. And then once someone's still living, to get them access to resources, so we buy time to engage. Individuals who are Senate Bill 123 funded no longer have access to these other dollars, this SOR, state opioid response dollars, to get medication-assisted treatment. So they got dropped off a couple of years ago when the payment mechanism shifted. We could no longer serve those individuals that were funded through Senate Bill 123 locally, so they couldn't have medication anymore because that funding does not reimburse for it. So that gap where there's individuals who need medication, such as Suboxone through our medication-assisted treatment clinic, who can't access these other funds, but the funds we're mentioning today and those going through the state, that other 75% could be access to serve those individuals. We purchased $5,000 worth of Narcan just at CKF to serve patients and make sure individuals with prescriptions, but also family members of individuals who are using substances can take these doses home with them and have them available. Narcan being available over the counter is fantastic. There are still people who cannot afford to purchase Narcan and won't have Narcan available at home when use occurs and when overdose occurs, and maybe when first responders haven't been notified. So just thinking of those gaps in care that exist, a grant process locally would be fantastic for local organizations. I was surprised to see MIR up there, and I'm in an association with MIR as we are providers across the state of addiction treatment. But I would focus on local providers, what's offered locally, and what's not. And if it's not offered locally, fair enough. But focus on first responders, treatment opportunities. Certainly there's some prevention opportunities along with that as well that aren't funded. To speak to the 75% that's available through the state of Kansas, that is being managed through, it started through the Attorney General's office. You've got the Kansas Fight Addiction Funds. That 75% is flowing now through Sunflower Foundation. Sunflower Foundation is based in Topeka, and they have a group of individuals who are deciding how those dollars can be spent so it can go through a grant process across the state. So that's a lot of money that'll be out there for a considerable period of time. Their first grant application process will begin, I believe, in March. The RFP will be released, and some funding will be dropped down. But right now they're going through a 12-month needs assessment to really understand how to get the majority of those dollars out the door in larger competitive grants versus maybe a smaller amount this first 12-month period, and I can't remember the total they settled on. So there are some other dollars available that can come to Saline County and across the state through that grant process, and CKF will certainly apply for some of those dollars as well. Thank you.
A lot of that went right over my head. So, yeah, do any other commissioners have questions of any of the?
Yeah, I have some mixed feelings on this. It feels like we're taking money and chasing a problem and trying to patch it. You know, how much of this could be directed toward prevention to prevent the problem from happening? The Narcan, as you described it, Shane, making it available to anyone over the counter, I just got an issue with that in that people will just use to that point of OD and knowing that, oh, if I OD, I got the Narcan.
Which isn't common if you look at research and information about substance use and what occurs with overdose and being revived, that someone who says, well, I might kill myself today, but maybe I'll be brought back to life, that's really suicidality versus when you talk about addiction in its most, broad and general form. Prevention's absolutely important. You are not going to prevent 100% of people from developing addiction because of the brain processes that go into addiction and what that means as far as genetic makeup, et cetera. So prevention is absolutely important. And if we can work with kids when they're young or people before they have a severe substance use disorder, and maybe it's mild at that point, even if it's genetic, that's fantastic. But there are still going to be people struggling with addiction that we need to save and treat.
And I think, part of that prevention, I'd like to see some of these funds geared towards medical provider education, kind of the mandatory type, so we can at least limit what we call iatrogenic, but the physician-directed dependence on drugs. This kind of reminds me of the, I think, 1970s, early 80s, when Valium and Librium were the number 1 and number 2 drugs in the world. And I may forget the exact percentage, but they calculated how many tablets were manufactured. Prescriptions only accounted for 15% of those tablets. So, there's another machine out there supplying drugs, and I'm not going to have a solution for how you get at that machine. But at least the ones that we have some control over, education will play a part. But medical providers need to understand, that we are often, contributing to the problem. But from what you're describing, Mr. Hudson, I could see us probably joining with 4 or 5 other neighboring counties. I mean, if only 40% are coming from Saline County, we need to try to get as many of that other 53% under an inclusive program. I don't think we have to rush to come up with it. I'd like to see what proposals are out there, rather than certainly have us 5 decide what to do with the money. If we could hit the source of the problem, it'd take billions of dollars to do that, because you'd have to eradicate lack of education, poverty, no housing, no job. I mean, it goes on and on. Not to mention just the mental health aspects that lead people to it. So it's a big problem, but if we talk to the folks who deal with it most often, we ought to be able to come up with something that we could put a dent in.
I guess I look at city staff, and we know where these dollars are coming to us. How do we move forward from here? And I guess my question is, who within the city staffing takes the lead on this?
Well, I guess what I'm hearing is a desire for collaboration and a little bit more broader approach, but I think that's going to take some time. My suggestion would be that we can reach out, see what kind of receptivity we get to that, but my concern is we may be into 2024 before that's addressed. So my suggestion would be that if you're open to it, we entertain a grant process similar to the emergency solution grant, or the special alcohol fund grants with the funds that the city has. If we have any other parties that wish to collaborate with us in the short run, we can take that approach, but then kind of take that longer term discussion, see if we can get some partnerships put together with the county, surrounding counties, those type of things. If we end up at that model, then I think you're looking at some overarching memos of understanding amongst the parties in terms of setting up a board and how they administer those funds.
So do these dollars need to be spent within the next year, or?
From a settlement perspective, they don't. I'm getting the sense of urgency just as it relates to the issue, that I think there's plenty of opportunities for good use of those funds in the short run, rather than potentially we could be talking a year and a half if we said we want to have everything in place for 2024.
Yeah, and that's, I guess, what I'm not sure what the best use of the funds.
What-
Right.
Did I see a hand back here that someone wanted to talk? Oh, you? No? Okay, I'm sorry. I thought
We
there was somebody
don't
else.
know when a next release of the funding may
Well, we
be.
know there'll
Like
be one
we
next-
got a June, so is there going to be a June coming up?
I'm not certain that there'll be another June, but I believe the next one will be next fall. I know we'll get one next spring. We got this one in
So we've
February,
got these
so.
funds now to consider, and then
Correct me if I'm wrong, but the format that's spelled out is each April. What we've seen is a June distribution of $11,000 in 2022, and then we're seeing some distributions right now, which is in advance of April. So maybe
It just
there
says
may be
by
more.
April, so
Yeah, so
it
there
could
may be
be
more, but
January, it could be April, depends on how the state processes them, but I would not anticipate seeing any more funding until next year, until 2024.
Now, it shouldn't take that long for us to collaborate with Saline County?
Well, but if some of
unless-
the agencies are taking the approach that they really aren't prepared to have the conversation until they've set their budget for 2024, then that kind of extends that conversation.
This may be something where we have to say, okay, we anticipate around this amount of money. And if it's, that much of a social imperative, it sounds like something we should be allocating funds for anyway. I mean, we're getting reimbursed, so to speak, for stuff that we need to do. So if we can get a ballpark figure, we can at least let the agencies have a rough idea. And yeah, we eventually pay ourselves back.
Right.
But-
So just so I'm clear, when you're referring to we, are you talking about the city or are you talking about a multi-county collaborative? Because I agree with
I think
you
it's
at the city level.
easiest to collaborate with Saline County. Because when you look at the resources we're spending, our guys are out in the county as much as they are in the city. And I just, for the city to bear the brunt of taking care of all the folks in the county, when the county has money they can contribute to this, should they be so inclined.
It's the so inclined part.
Figured I'd throw
And
that
not to
in,
say that they
right?
aren't, it's the timing of it all. And so I guess my suggestion is pursue that a little bit, but if that's not making, if the timing's not working out, then the question is, do we want in this first cycle to proceed with our own process to expedite getting some funding
Do
out?
counties get more than cities, or is it like
It sounds like they're getting a
taxes?
little bit less,
They get more like the other taxes?
but same general ballpark.
Oh, right, okay.
And
What about surrounding counties, like Ellsworth, Ottawa? I'm guessing those patients are going to end up here. Is that pretty accurate?
Depending what they need. Yes. I mean, there's different facilities,
Yeah,
medical
so,
and otherwise, depending on the county.
and I don't know if every county's getting fund distributions, I suppose.
Right.
But,
They are, just I assume it's on a per capita basis, so from a dollar.
Chose
They are if they chose to be a participant.
That's true, yeah.
Which 200 political subdivisions in the state of Kansas are participating. I can't tell you if those are cities or counties and what that makeup is, but 200 in the state of Kansas.
So I guess the other thing I would offer is Saline County's taken much more of a grant processing approach to ARPA funds, and they've demonstrated they're good at it. And if it's a broader collaborative, it wouldn't hurt my feelings at all to be partner with some other agency in terms of their efforts, but we have an obligation to use these funds somehow. I guess what I'm saying is part of that conversation might be is the county wanting to take the lead, or is a other agency wanting to take the lead?
Has the county had this type of deliberation yet, what we're doing
No.
today?
And again, I don't want to speak for them, but my understanding was they're kind of more focused on what do they have in the 2023 budget. This wasn't in the 2023 budget. They'll take it up for the 2024 budget.
that mean they'd hold their distribution of funds and then think about it next year?
I think that's a
Unless
possibility,
we
yeah.
maybe
Right,
propose something to them.
right.
It would probably require a budget amendment for them, just as it would us. If we chose to do something create its own fund, we'd have to establish a budget for that, so we'd have to go through an amendment process for those funds to spend them.
Jacob, I noticed there's a couple people online. Has anyone wished to speak? I noticed that.
Yeah, I would like to say a couple of things. I appreciate
could
y'all
you
inviting
please-
me
could
here.
you
My name
please-
is Amanda Ryan. I'm a
Okay, thank you.
physician at Salina Family Health Care and have a strong passion for addictions management. I just got to meet Shane, and he was a really nice guy, so I look forward to collaborating with him on multiple things. But when it comes to these funds, I guess I have a couple of thoughts. One, I would probably manage, because there's so much unpredictability, as money that you have is the only thing that you can guarantee when it comes to grants, unless you're going to collaborate with somebody else. Excuse me. From there, I was kind of the main author on that letter to see if we could be involved as well in the distribution of funds. I would love to put together even, a group or coalition to review those grant funding, because I think we have a lot of outside resources that we could also use to fulfill the goals of grants without having to dip into this opiate fund. Understanding that the money that we're getting in is trying to clog a fire hydrant with a bathtub plug. It isn't going to fix every single problem, but some of the key things are going to be prevention and looking at high school programs and how we can incorporate that. And then Narcan's a big thing, but we get a fair amount through DECA, which is also grant funded and maybe a resource that the EMS and first line folks could use too. So I think there's some options out there that we could make sure that we're utilizing the funds to their full capacity.
Any questions for Dr. Ryan? Yeah, I know there needs to be a collaboration of someone, and it's probably not the five of us up here that are more in tune, so I don't know how we go about that. I guess I look at.
Well, from a staff's perspective, we can certainly move that conversation along. I guess my question of you is if those collaboration conversations look like they're extending into 2024, is that acceptable, or is there a sense that you think we should conduct a process in 2023 standalone?
Well, I guess my thought is that I have the feeling there's additional resources coming that may be more substantial than this, but I'm comfortable with the idea of maybe now trying to partner with the county and disperse what we have received at this point and using a granting process that, as long as everyone's aware that we're really kind of interested in a regional collaboration of some form. I mean, I guess we're just trying to get the most use out of the money that we possibly can. So that's my thought.
I would echo that 100%.
Agreed.
Okay. I'll certainly follow up, and just in the interest of transparency, one of the points of conversation on my part is going to be who's the most appropriate agency, other than us administering special alcohol funds and responding from a public safety standpoint. This really isn't in our wheelhouse as it might be from some other agencies.
We
but
often split the special alcohol fund between different entities, so there could be competing grants that we could choose to partially fund or.
Well, what I was referring to is there a lead agency to try to foster this collaboration other than the city, and then we participate with them in terms of their process. But we'll pursue all of the above.
And we have different agencies performing different services, different parts of the whole treatment spectrum. So it would probably take collaboration on their part as well. I'm not trying to get this done by next Thursday, but if we solicit proper term, but not, well, I guess it would be a request for a proposal or the equivalent of that. I think we'd find out who the active agencies are and their interest.
Yeah, I think we've got two things going on here. When was referring to agency, I was referring to kind of a lead agency to run a grant program across multiple counties. So you've got that question. Then yes, there are agencies individually that would offer programs that if we treated it more like the special alcohol tax, we could fund multiples of them. But what I'm hearing from you as a governing body is you first want to pursue a broader multi-county collaborative approach.
I'm all for that, with the exception of maybe we need to check in with our first responding agencies or departments to see if there's not any priority items that they might be able to utilize
I
or
think we ought to
purchase.
reimburse ourselves. Yeah.
Well, and I think we need to
care
keep
of
in
all.
mind that we are kind of a collecting point in terms of service. And I'm not saying it's an absolute, but we are going to get runoff or residual from maybe surrounding areas. And as much as a collaborative effort, I think is a very great idea, and it's kind-hearted, which is nice as well. But maybe we do more than the lion's share of work in our area, and we're just not aware of it because we're not the ones responding to these calls. And so I guess I would refer to you guys and get your opinion on it, if you would, please. I'm not trying to put you on the spot. I want to make sure that your perspective is heard.
Sure, no, I appreciate that. As far as the Narcan goes, I think Debbie mentioned already that that's something we're obtaining at no cost right now from a state agency. But as far as responding to the calls and things, investigations dealing with these, we do that quite a bit. We're having probably seeing 1 to 2 deaths a month associated, not necessarily with the diversion of prescription medications, but more from a fentanyl standpoint. And so we are seeing that. We're dealing with it as best we can. There could be some ideas, but I think also, some of these partner agencies within our community that are helping stem the tide of the people that are getting to the point of overdosing. I think that's very beneficial as well to helping stop, our interaction with these folks. But it is difficult, for sure. But at this point, unless the chief has some other thoughts, or
I agree with you.
okay.
Thank you.
Shane Pearson again with the fire department. From our perspective, cost-wise, direct impact to the fire department is obviously our cost of Narcan. As Ms. Pack showed earlier, it's the IV form that we carry is $35 for a 4 milligram dose. So if we did give it 50 times a year, whatever that may be, cut plus a little bit more to, if we had some expire, that sort of thing. Money coming directly back to us, the guys are on duty every day. Those costs, there could be some other ancillary costs associated with responding to the call, other supplies, IV supplies, that sort of thing. But I think overall, financial impact is not tremendous to our supply budget in the grand scheme of things. And I agree with Deputy Chief Morton that maybe using these funds to help offset the folks that we are seeing. If we could reduce that, then there's a reduction in cost to us as well. And that's just my personal perspective on that, is would like to see, on the prevention side, utilizing those funds more so than, I'm not saying that reimbursing the department's EMS budget line is not appropriate, but with the amount of funds not being unknown what you're going to get, I think working with the other agencies in the community would be more beneficial for us.
And that is one of the first things we looked at. If the numbers were different,
Right.
either in cost or quantity, we might be having a different conversation, but it's pretty
Obviously,
nominal.
our numbers are increasing, but
Right.
not to the point on this specific topic and this specific patient population that if we could reduce those, that'd be great. And get back to where we were, 4 or 5 years ago and see that number start decreasing. I think I agree with you that would be beneficial. Thank you.
You don't have any. You don't have any direction right now, do you? Really?
Well, I'll try to restate what I think I heard, and you tell me if I've got this wrong. There's definitely interest in a collaborative approach, not only with Saline County but beyond. And I will commit myself and staff to pursue that. The thing that I would tell you is, I don't know that I'm going to lead with the city of Salina needs to lead a multi-county effort as it relates to opioids, but I'll try to get that conversation moving. And the other thing that I heard is some patience on your part to pursue that before we try to roll out, a grant fund at the city level. But I can certainly report back how much receptivity there is. If it looks like that timeline is going to play itself out over an extended amount of time, then we can revisit whether we want to try to do something in 2023 at the city level with city funds only.
Yeah, and I'm not sure how we need to draw on the professionals, whether it's with CKF or if it's with Salina Family Health Care Center, the hospital, whoever. Some of those individuals need to be involved in those conversations because they're the experts. They know where the treatment lies, how the funds are being dispersed and need to be used. So I don't know how we bring those people into the fold. I mean, because that's the important thing. To use the whole key is to use the dollars to be effective in what we want to do.
Well, and I think that we certainly want them in that conversation on the front end. Ultimately, they'll likely be recipients of funding on the back end as well. So we'll just need to take all that into account.
And these are all good, but they're time-consuming for city staff.
Yeah, and this, other than treatment on a public safety standpoint, this is a little out of our wheelhouse,
Right.
but
But it is a driver of utilization of city services.
certainly.
This is an opportunity to hit it on the front end, because sooner or later, we are going to pay for it on the back end. So-
I don't disagree. The only reason I say that is I don't know that I personally or the city of Salina ultimately needs to be the lead agency if we can put a different collaboration together.
Right.
Well, maybe, I'm just throwing this out, County Department of Health, but when you consider this city is the lead city for most of these services, it might not be a bad idea to have some influence. I didn't want to use the word control, but heavy influence on the nature of the program, because this is where folks end up.
Well, and I think the amount of funds that we're receiving is going to be significant in general and in comparison to the other agencies. So there's that as well.
Okay.
If you agree with our kind of collective description, we'll start pursuing that path.
Okay. Thank you to everyone for your attendance and your input. Okay, we have a dual study session today, and I'm going to look to the city manager. I believe we are going to start with the slideshow and then move into a memo we have. So,
Commissioner Longvine asked for the opportunity to address you on this topic, and so I'll turn it over to him. And then, I guess while he's coming to the podium, and then Jim, you have a copy of a memo from Jim Teutsch as well. So asked him to be prepared to kind of provide his insights as well.
Thought they were going to stick around. Thank you, Mayor and Commissioners, for allowing me to come share today. What I'm going to share is something that's just been a kind of a passion and issue that I just notice. When I travel around, I see a lot of improvements and things going on, and I come back here and I say, we could do better. We could do better. And this started out as an assignment, and I took it a step further to present here at the commission to improve our traffic signals, the visibility. Here in Salina, we have several high accident intersections that could benefit from adding reflective backplates to the traffic lights. The benefits of using reflective backplates on signals have shown to increase safety and visibility There are several signals in need of repair due to wind damage and deterioration. As the traffic control crews work to upgrade signals, I think it would be worth considering using reflective backplates. In this slide, you can see how adding a reflective strip to the backplate increases the visibility of the signal lights. Next slide. Some of the most serious accidents here in Salina have occurred at the intersections of Broadway and Crawford, Santa Fe and Crawford, Ohio and Crawford, kind of a little pattern there, and 9th and Magnolia and Schilling and Magnolia. When we see accidents like this, we should all be concerned. This was a side impact collision with full airbag deployment. As you can see, the signal in the center is missing the backplate altogether. Maintaining traffic signals is critical to traffic safety. The backplate adds contrast to the signals and reduces backlighting when the sun is an issue. It is important to overall visibility of the red, yellow, and green lights. Next slide. In these pictures, you can see the traffic signals with the reflective borders stand out. The signals on the right with no border appears to blend in with the overcast sky. Reflective borders have many advantages which increase visibility and traffic safety. According to the Federal Department of Transportation, using reflective strips enhances traffic safety visibility and orientation for both older drivers and those with vision impairment. This countermeasure is also effective during periods of power outages when the signals would otherwise be dark, providing a cue for motorists to stop at the intersection ahead. And last September, we were at an event downtown and a huge thunderstorm rolled in, and we drove home. All the signals were out. Limbs were down, streets were flooded, and it was just a kind of a creepy feeling, everything dark. And it doesn't happen often, but it does happen. Next slide. This is an example of an intersection in Wichita, fairly new intersection. There in the background was my grandson's school from last year. Has reflective backplates installed. As we maintain our signals in Salina, this application can be beneficial. Next slide. And here's another example of the reflective qualities at night. Next slide. This is how the intersection of Broadway and Crawford looks today. There's a lot of room for improvement here. The center light is missing the backplate, and the right one is damaged. Slide. Of all the major intersections I've observed in Salina, Broadway and Crawford sticks out, needing the most attention. Here's another view looking southbound. As you can see, the backplate's missing. Things just could be improved. And I might add that since bringing this issue to light, Public Works has made some improvements here at this intersection. How can we improve our traffic signals? Funding sources could come from funds available in the street department budget or possibly Department of Transportation grants for safety projects. Jim Toish will have some more information on this to follow. It would make sense to begin with intersections with missing or damaged signal backplates. The next phase would address intersections with high accident rates. Moving forward, it should be a goal to include high visibility reflective borders on all high traffic signals in the city. The 3M Corporation is the primary supplier of reflective materials. Included are links to the 3M Road Safety Resources page and a very informative resource from the Department of Transportation study on the use of backplates with reflective borders. After some additional research, it became apparent the reflective tape does not stick to textured backplates. And Jim has indicated that all of our signals have the textured backplates, so hence the $35 per signal is not going to work. So Jim will have more information on this, but the initial scope of the project was just to buy the tape, have it applied to the existing signals. And next slide. Upon your approval to proceed, we hope to secure funding, get underway with upgrading signals soon. Be glad to answer any questions or comments on this proposal.
Got any data that tells us that once these improvements are made, the situation changes with the number of severe accidents? I mean, is it the tape or is it just the people are inattentive?
Hey, Carl, your
in a busy
mic's not on.
intersection?
Your mic's not on.
Oh, I apologize.
Don't do that to me, Carl.
I know, but I should know better than anybody, right? So I
thought
said,
it was just me.
Is there any data to show that once these
Yes,
improvements
there
are made,
is.
that the intersection gets better?
Data shows a 15% improvement, and Jim has crunched the numbers on that a little bit, and he'll have some more information. But from my experience, you approach an intersection with this reflective qualities, it just pops that, you know, we've all probably went through an intersection and thought, I just ran a red light. And I think most time when that happens to people, it's they didn't see it. Had something else on their mind. And it just, especially at night, it just really stands out. We got an intersection here. And I think we're probably running out of time, and I will defer to Jim.
Even just having the back plates on is an improvement over some of them. When
Yeah.
you don't really realize it until you compare that just the back plates is an improvement.
And this is
also.
what really drove this for me is like Broadway and Crawford. I hate to pick on that so much, but it was in really bad shape, and with no back plates at all. And a lot of it was stemmed from the the big storm a year ago, December. So,
Is that why they're missing in some places?
Yeah. Yeah, and they just break down and deteriorate.
Okay.
Sir.
Thank you, Commissioner.
Mr. Mayor and Commissioners, I'll try to be very brief. You have received as part of the packet, you've received the information paper that I provided to the city manager. I guess just a couple of points. First, I want to thank Commissioner Longbine because he didn't just bring this idea to you, but he and I have talked about this on an ongoing basis over the past several weeks, and I truly appreciate him thinking enough of me to engage with me on this topic. So thank you, sir. He is right that the MUTCD, the U.S. Department of Transportation, and the Federal Highway Administration all support the use of reflective backplates, primarily the use of backplates, and then they are further enhanced when you use retroreflective tape on them. It does create a controlled contrast background, which is what he was talking about, the gray sky versus, on one without versus one with. It makes a huge difference both in daytime and nighttime. So on those things, we certainly agree. This is a human factors enhancement. It is much like some of the other things that we've done. If you see any of the pedestrian crosswalks with the flashing ring around the red lights, that's another example of human factors enhancement. So the key here for me really comes down to identifying not just high accident intersections, but identifying of those intersections, which intersections have the greatest problem for conspicuity problems. So I asked our GIS supervisor to download every accident in Salina for the past 2 years at these 5 intersections to just run a test. There were 69 accidents over those 2 years. And I fully admit in the information paper and before you today that this is interpretive. And the reason it's interpretive is because I'm looking for exactly what Commissioner Longbine described, where you are a driver, you're paying attention, but you just miss that light. And so there could be intersections that have a higher number of accidents, but it's not really due to conspicuity. It's not really due to people missing the intersection. For example, when you have a double left turn and you have cars both making that turn and one running into each other, that has nothing to do with this problem. So the end result of that study, though, was that I felt 13% of these accidents may be improved if we had retroreflective tape on backplates on the signals. And that is in keeping with what the Federal Highway Administration says, up to 15%. So I felt like that it was a good way to compare. So the last couple things I want to say is I have 3 traffic control technicians. We have 720 signals. In addition to the signals, they're responsible for all of the control boxes for every intersection. They reinstall knockdowns when they occur. A knockdown is due to wind event or something else. Straightening signs and signals. Responding to stolen signs, cleaning cabinets, performing maintenance on those cabinets, troubleshooting equipment, and the list goes on and on. So if I get nothing else out, I want to say, I really hope that people understand that those traffic technicians are doing an outstanding job. There's 3 of them, and the amount of work that goes into what they do is tremendous. When I'm getting ready to lose one of those technicians this year for retirement. It takes me 2 years to train a technician once we hire him. So I'm in the process of getting ready to talk to the city manager about seeing if I can't bring someone on to job shadow to help fill that in. But you will find in one of the windiest states, you will find traffic signals that are crooked. You will find backplates that are missing or backplates that have been snapped off by flying debris. We take it seriously and we want to repair them as soon as we can. There is something in Public Works called the Traffic Safety Committee, and that is made up of Public Works people. I have he's a civil engineer, but he specializes in traffic, Mr. Johnson, and a number of others in the engineering department who participate in that committee. I would ask that I be allowed to convene them and allow the police department, the fire department, and the engineers to analyze the intersections and say, these are the ones that we believe would be most likely to be affected by this particular problem. We talked about 5 intersections, but keep in mind that is 63 signal heads at those 5 intersections. And if you think about it, I got to put a ladder truck up there, somebody in traffic. It is a time-consuming process. What I would really like to see is allow us to develop this as a part of our strategic annual replacement program. We do it for push buttons, stoplights, traffic signs, everything that's part of the traffic program. And I think that would be a good way to handle this. And I'll end on, we just recently received approval for a $200,000 grant to do for Safer Streets and Roads for All, the SS4A program. And that is specifically to develop an action plan. But I do think that part of that action plan may be able to be geared toward this topic, and that may help us, once we have the action plan, then participate in implementation grants. And those grants do specifically call out examples that are very much like this problem. And I think that it probably could be funded through an SS4A implementation grant. So with that, I'll certainly answer any questions you have, and thank you.
Any questions?
How often do you have to change the actual traffic signal, the light that's in there?
It really depends. They generally last for years. It's not something that you have to do all the time, but we have had just bad signals that prematurely went bad that we've had to replace. We've recently lost several signals when a truck didn't lower his boom and took several of them out. So yeah, we replace them on a fairly regular basis.
But you're saying of those 6 intersections, was that the number?
5.
There's 63 signals?
That's correct.
Within, so that's
Yeah,
approaching 8% or something of the total. That you said 750, you've got 750 of those signals?
Yeah, about 720 total. Those 5 intersections have 63, if I remember correctly. Because it depends on what traffic action is taking place, whether that's whether there's turning lanes and all the different actions that can take place. It helps decide how many that we have to have. Those 63 signal heads, to buy reflective backplates at an average cost of about $154 a month would be about $9,300. That is something I can absorb in the traffic control budget. And that's kind of why, it's the way that we've programmed every other aspect of our traffic signal program, our traffic control work group in its entirety. We buy an X number, maybe 20 or 30 push buttons every year because we know that we're going to have some go bad, so we allocate money to that. So I would think that we could reasonably do a similar thing within the existing budget if we're able to do this a few intersections at a time.
So the backplates will fit onto our current lighting system, yeah.
Yeah, we would have to, those 63, there are 3-section, 4-section, and 5-section lights. So there's 3, 4, or 5 lights in each head. And the costs are obviously different. A 3-section head is roughly $140. A 4-section is roughly $154. A 5-section would be about $168 to buy a reflective backplate for. Now, I also want to say in Commissioner Longbind's defense that the 35 does return once we have installed smooth backplates on our signals. So where the Traffic Safety Committee would find, and that brings up another point, we would have to, and this is why having the engineers, police and fire, and those people as part of this, we would have to develop traffic warrants. What is the criteria used that determines whether or not reflective backplates are put on this intersection? And that's a process that committee would have to develop. We're certainly willing to do that if we're allowed.
Did your little sample that you took, did that suggest any directionality within an intersection?
Well, yeah, typically it was accidents where people were running red lights. Those are the intersections, and not all of those, because the traffic officers provide narrative in addition to filling out the form. They provide narrative. So sometimes running a red light doesn't necessarily mean that it was, I didn't see the light. And that's partly why I told you it was interpretive, because you kind of have to read those reports. I looked at how old they were, whether it happened at day or night. Did the officer indicate whether there was any inclement weather involved, and then the nature of the accident itself, what happened in that accident, and was the traffic officer able to ascribe fault? And then if there was fault, then is this likely a cause from conspicuity? and 9 of the 69, or 13%, were. Thank you.
Okay.
Conspicuity, I really like that
Conspicuity.
word. I've never heard that.
Okay, we have about 5 minutes. We're going to reset or break and for the commission. I'd like to thank Jim for his time and also thank Commissioner Longbine for your presentation. So with that, we will see everyone back here at 4. Okay, it's 4 o'clock. It's 4 o'clock. We will call the February 27th Salina City Commission meeting to order. First on the agenda, I will look to staff for confirmation that the Kansas Open Meeting Act required notice has been properly provided.
Yes.
Thank you. With that, could we have roll call?
Mayor Hoppick.
Here.
Commissioner Davis.
Here.
Commissioner Lankowitz.
Here.
Commissioner Longbine.
Here.
Commissioner Ryan.
Here.
Thank you. Would those who are able please stand for the Pledge of Allegiance and a moment of silence? I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. Okay, we have no awards or proclamations today. Also, no public hearings or items scheduled for a certain time. So that will lead us to the consent agenda.
Item 5.1, approve the minutes of February 13th, 2023. Item 5.2, approve change order number 1 for the 2019 water main replacement project, number 1, 90039, Kansas Public Water Supply Loan Fund, project number 2997. Item 5.3, award the bid for project number 22034 for concrete improvements at various city parks to Seton Construction Group, LLC, in the amount of $202,790, and authorize the city manager to execute a contract with Seton Construction Group, LLC, upon fulfillment of all prerequisites under the bid documents. Item 5.4, award the bid for project number 23014, 2023 microsurfacing to Vance Brothers, Inc. of Kansas City, Missouri, in the amount of $892,605.76, with a 5% construction contingency, for a total project authorization not to exceed $937,236.05, and authorizing the city manager to execute a contract with Vance Brothers, Inc. of Kansas City, Missouri, upon fulfillment of all prerequisites under the bid documents. And 5.5, award the bid for project number 23015, 2023 ultra-thin bonded asphalt surface to APAC Kansas Shears Division of Salina in the amount of $759,039.55, with a 5% construction contingency, for a total project authorization not to exceed $796,991.53, and authorizing the city manager to execute a contract with APAC Kansas Shears Division of Salina upon fulfillment of all prerequisites under the bid documents.
Okay. Need a drink of water there, probably. Okay. I would personally like to remove item 5.2 from consent agenda. Are there any other items a commissioner would like to?
I would like to remove 5.3.
And 5.3. Okay. Okay. With that, do we have a motion to approve the other consent agenda item?
Mayor, I would move that we approve 5.1, 5.4, and 5.5 as presented.
Second. Sorry.
We have a first and a second to approve consent agenda items 5.1, 5.4, and 5.5. All those in favor?
Aye.
Aye. Opposed? Okay. Item 5.2, yeah, Martha?
So would you like a full staff report, or would you
No,
like to post questions?
No, couple questions. I noticed this is just dealing with Project 1, is that correct?
That is correct.
Now, is Project 2, there's several change orders, and again, my memory's not what it used to be. Have we approved any of those, or will those be approved when Project number 2 is completed?
They'll come through with Project 2. Project number, or change order number 1 was for a situation in the field where we had an existing force main that was in position to where we had to relocate our water line. So it was one of those things we had to do quickly and keep the contractor moving. And that's the same for change order number 2, we had a situation where we missed making a couple of tie-ins, and had we kept going, we'd have had a section of neighborhood out of water. So a couple of things that came up that needed pretty speedy response, and those have been taken care of, and all of that'll come to you at one time.
Well, yeah, my concern was we listed both project number 1 and 2 on the blue sheet, but it appeared we only voting on one, so that was my
And I
question.
put probably a case of providing too much information also, but I was trying to let you know that we're still well under budget with both projects as we stand with all of these change orders. That was my goal, to let you know we're still a couple $100,000 under budget, so you didn't think we were spending on past where we should be.
Okay, thank you. Does anyone else have any questions?
I had a question. It states here an additional 500 feet of water line due to an error in bid quantities. Was that error in the design to begin with, or?
Yes, it was left out of the quantities that that the staff provided to the bidders to bid. They bid all on an equal amount. And no, none of the bidders noticed it, and we were getting very close to the end of the project, and the pipe pile was small for the work we had left. So the contractor nor our staff had really identified that till fairly close to the end. So just an error, and I think probably looking at one page of the drawings and didn't get the number copied over for the quantity on that page, but it was not provided.
Okay, if there are no other questions, I will accept a motion to approve consent agenda item 5.2.
Move we approve 5.2.
Second.
We have a motion and a second to approve consent agenda item 5.2. All those in favor?
Aye.
Opposed? Thank you, Ms. Tasker, for your time. That leads us to item 5.3. And I will look to Commissioner Longbine for, you have some specific questions for Mr. Hammond?
The primary question was the Seton Construction Company. Have we used them before? That's a new name to me.
Not that I'm aware of. I did do some due diligence to ask around. I asked our engineering team, and they were not familiar with their work as well. They have not been on a previous project to their knowledge. We did check references of that group, and they came back very favorable for larger projects in the Wichita area.
Yeah, their bid was very favorable compared to the other two bids, but I do like to keep things local. Of course, everyone local is busy and stretched. On the parking lots, gonna pave the lot at Oakdale and Sunset. Gonna create a new lot at Sunset, is that correct?
The Oakdale lots, there's two small gravel lots that are on the east side of the park that will be concrete, paved with concrete. Sunset was, there's a lack of ADA parking at Sunset Park. And so we created two different sub-projects within Sunset Park. One is parking specifically for the War Memorial, and then one is specifically on the north side of the park for the playground.
Okay. And my concern was with the parking near the War Memorial, if that will work in conjunction and not with the War Memorial expansion project. That's
it'll complement it, and more so than be in any conflict with it. When we had those areas designed by our engineer, hired engineer company, I think it was the last Veterans Day when we had the last service there. I walked that area with the War Memorial group, showed them what we were proposing to do, and they had no problems.
okay. Okay, so I just didn't.
I think they were looking forward to having some more closer parking.
Right. It's a worthy project, and I just wanted to make sure it wasn't gonna crowd one thing or another.
Right.
Okay, thank you.
Thank you.
Any other questions of Mr. Hammond? No. Okay, thank you, Mr. Hammond. With that, I will accept a motion to approve consent agenda item 5.3.
Move to approve consent agenda item 5.3.
I'll second that.
We have a motion and a second to approve consent agenda item 5.3. All those in favor? Aye. Opposed? That passes 5-0. Thank you very much. That will lead us to administration.
Item 6.1, approve resolution number 23-8107, appointing members to citizen boards, commissions, and committees.
Okay. I guess everyone has that resolution in front of them. I will read off those individuals that have been or being nominated to serve on certain boards, and we appreciate those individuals for their dedication to do that. Salina Airport Authority is Donald Boos and John O'Brien. Business Improvement District Design Review Board is Tanner Donner. Community Art and Design Advisory Committee is Terry Schweitzer. Convention and Tourism Committee, Steve Owens. Human Relations Commission, Kayla Tagg Hurd, Brenda Mai, and Olivia Owens. City Planning Commission is Tom Sindow. And Solid Waste Management Committee is Jay Veneer and Jasmine Cassim. Are there any questions or comments from the board?
I'd just like to commend city staff for really the media department putting this out to get people involved and interested. They did a good job getting the word out, and thank people who are willing to step up and serve in various boards and committees. We do need more people. There's still boards that have vacancies, and so I would just urge people to give it consideration and get involved in your city.
Okay. Any comments from the public? Okay, if not, I will bring it back to the commission for action.
Mayor, I move we approve resolution number 23-8107, appointing members to citizens boards, commissions, and committees.
Second.
We have a motion and a second to approve resolution number 23-8107, appointing members to citizens boards, commissions, and committees. All those in favor?
Aye.
Opposed? That passes 5-0. Thank you. That'll lead us to item 6.2.
Item 6.2, approve resolution number 23-8112, authorizing the mayor to acknowledge a resolution stating the permanent status of the Smoky Hill Museum.
Hello, I'm Susan Hawksworth. I'm Museum Director of the Smoky Hill Museum. And this year, the museum is up for reaccreditation with the American Alliance of Museums. That program has been around since 1971 and is the national recognition of a museum's commitment to excellence and highest professional standards of museum operation and public service. The Smoky Hill Museum has been accredited since 1997. And as I said, we are up for reaccreditation. We are one of only 11 accredited museums in Kansas and one of only 3% of all museums nationwide to be accredited. The accreditation process takes 8 to 16 months to do, and it's based on self-study and documentation. And that is one of the reasons I'm in front of you today, is for documentation from our parent organization. We have to show documentation regarding the importance of the museum to the parent organization and expressing the parent organization's commitment to support the museum. So with this resolution, the Smoky Hill Museum is asking the city to express this commitment and support of the museum, and thus fulfilling the documentation required for the accreditation self-study. This resolution indicates only continued support. We are not asking for additional support funding sought with this resolution. The commission has presented the following considerations. Staff has presented the following considerations to the City Commission, let me say that correctly. To approve resolution number 23-8112, approve resolution number 23-8112 with amendments to the City Commission deems appropriate. Postpone consideration of the resolution to a specified date and time and provide staff direction regarding additional information or amendments the City Commission would like to request for their further consideration, or vote to deny resolution number 23-8112, resulting in a negative reflection on the museum's accreditation report.
Okay.
Are there any questions?
Thank you, Susan. Yes, I'll look to my right, any questions or comments?
Yep.
Okay.
I'm just kind of curious, how much traffic does our museum get?
We have, that's kind of hard to say. We reach about 35,000 people a year. Most of that is on-site, but some is off-site as well through social media and our website. But on-site, I would say about 20,000 of that is either coming just through the front door or for a special event or program that we have going on.
Okay, thank you.
Any comments or questions from the public?
Hello.
Good afternoon, John Blanchard, Salina. You know, a lot of times we have things that we can complain about. I think when we have things that we can really praise, I think we ought to do that too. I think that the museum itself is one of the best around. I think their reputation is amazing. The staff is phenomenal. The designer, and I forget his name, but I want to recognize him because your designer is
Josh Morris.
Joshua
Morris.
Joshua Morris. He's amazing. He is simply amazing. Also, I appreciate the community outreach that's done with the museum. You can turn on the radio, and very often you'll catch an ad for what's going on at the museum or for a lecture series or those types of things. So I just want to say that we really are fortunate to have such a high-class museum, and I certainly encourage people to go there all the time, but I would support the resolution and fully support the museum. Thank you.
Thank you, John.
Thank you. Any other comments? Yeah, it is. If you haven't been in there, you need to go in there. And how often do you change out the
Temporary exhibits are about every 6 months. The current one is going to be up just slightly longer. It's on fire, the Embers of Discovery, and it's up through beginning of October.
Yeah, and admission is free. It's by donation if you wish to. So I suggest everyone go in. It's a hidden gem that a lot of people, it's always fun to drive by there and see either school buses or buses from out of town there that are visiting. So thank you for all your hard work. So with that, I will bring it back to the commission.
Mayor, I move we approve resolution number 23-8112.
Second.
We have a motion to approve resolution number 23-8112. All those in favor?
Aye.
Aye. Opposed? That passes 5-0. Thank you very much. That will lead us to item 6.3.
Item 6.3, consider authorizing city manager to engage special counsel for Overlook Estates platting matter.
Thank you, Mayor and Commissioners. As I believe you're aware, a River Run plat is forthcoming to the Planning Commission and ultimately to you as the City Commission. There's been some questions raised about kind of the history and some technical interpretations and application of code and subdivision regulations. As the staff report indicates, there is a member of Clark Mize and Linville's firm, which is our city legal counsel. Aaron Martin resides in the current phase of River Run, and you'll see there's a reference to Overlook Estates. That's the chosen name for the future development by the current developer. And so that represents the possibility of a conflict. I anticipate as staffs through the question and prepares their staff report for both the Planning Commission and ultimately you, that I want to be able to engage legal counsel in advance, have them review that and confirm their agreement or provide direction, and with that possible conflict, that creates the need for special outside counsel. We tried to identify those that have planning and zoning experience. Either there's a publication that Mr. Banks can speak to more specifically in terms of kind of listing attorneys' criteria, and then as noted, the legal counsel that was in-house counsel for the city of Derby recently transitioned to going to a law firm, and so reached out to them, and some of the delay was their need to run a conflicts check just to ensure that they, with the firm or otherwise, didn't have any conflicts that could prevent them from representing us. But her name is Jacqueline Butler, and so our proposed approach is to engage Ms. Butler as special counsel on this topic. You should have, an amended agenda went out once we received confirmation of the conflicts check, and so you should have it at your places, both the memorandum for special counsel services as well as her bio. And again, kind of in recapping that, it's really just trying to get alternate legal counsel in place so that I have a resource to consult in preparation for Planning Commission and City Commission consideration of the upcoming item. With that, your options are that you could approve the city manager to engage in that special counsel. You could provide alternate direction in some form and decline at this time, and we could regroup as you might see fit. But I'd happy to try to answer any questions you might have.
Is this action taken if certain opinions were needed, or would that attorney sit through all the usual deliberations and offer
Yeah, the primary focus is kind of that legal advice as we finalize the staff report. I think other than that, we'd utilize them similar to the way that we use legal counsel in terms of Planning Commission. In anticipation of kind of your deliberation on the issue, we may ask her to be available as needed. So in direct answer to your question, primary focus is review and providing an opinion on the topic, but then we'll assess whether it would be appropriate to have her engaged at the Planning Commission and City Commission level.
The city attorney currently sits at the Planning Commission meetings?
No, we do not.
Okay.
If called upon to address...
I'm sorry, go ahead.
If called upon to address specific issues, we can participate, but as a general rule, we do not attend Planning Commission meetings.
Right, so the assumption would be that this attorney would not need to come up here for the
Planning Commission?
The Planning Commission.
No, we might just make sure that they're available if something arises. But similar to Greg serving as legal counsel, on occasion he'll be aware that the Planning Commission is meeting and available if needed on a case-by-case basis. So that's certainly an option. Obviously, legal counsel attends the City Commission meetings, and we'd be sure that they were available there as well.
Okay. That's it. Thank you.
Commissioner Ryan, any questions?
No questions. Thank you.
This direction. Okay, are there any questions or comments from the public on this?
John Blanchard, this is what I came for, so just got the bonus of the museum. The staff report said that it was with the platting process and so on. I'm assuming that this has nothing to do with the emergency access road, as that is a requirement in the subdivision regulations and not the process. It's codified already. But the one thing a couple things concern me. One is that it seems like this is an open-ended blank check. How much is this going to cost? It doesn't matter how much the hourly cost is. It's how much do we anticipate this costing in total? And that would be during the planning process, during any appeals. If the Planning Commission receives a protest, will that attorney be working on an appeal process? Or if there's, because it sounds like we're headed to some sort of litigation here. It seems highly unusual that somebody living in a subdivision would be grounds for recusal and a conflict of interest. I mean, it just seems to me that unless it, and you can fill me in, if it has to do with the homeowners association, if Overlook whatever subdivision is going to be completely separate from River Run, then you might have homeowners association issues. You also might have special assessment issues, and you might also have open space issues that the owners there had bought into at River Run. So maybe you can explain what the nature of the conflict is, because I hate to hire, we have perfectly good attorneys here. We have a great assistant city manager who seems to know an awful lot about legal issues, and we're paying a lot of money for him. I would just like to see us not run to special counsel, special attorneys, special auditors, all those things every time we have an issue that we've known about for months and we've kind of let fester. So hopefully you can answer some of those questions, but the primary thing is taxpayers don't want an open check on legal fees, and so if you can address that first, I'd appreciate it. Thank you.
Sure. I'll try to address a couple of those. As you well know, it's hard to know how many billable hours there may be on any topic that involves legal. Certainly try to strike a balance, somewhat to your prior questions, Commissioner Davis, about what we expect of them in terms of attending a meeting. We try to manage that, strike a balance the best we can, but I don't have any ability to tell you how many it wouldn't be prudent to say we're going to cap this at X number of hours depending on where the conversation goes. With respect to the possibility of litigation, not really anticipating that. In fact, if there's litigation involved, then we may be looking to our insurance provider to provide that representation. It's more just trying to be objective and responsive to the concern and avoid any appearance of conflict as we move forward on this particular topic. Now, depending on where the conversation goes, it is primary platting, but as questions arise or are raised, need legal counsel to confer with. And then ultimately, with respect to other attorneys on staff, we don't look to them to represent us, provide us legal counsel as it relates to litigation, as much as that's a skill set that helps them write write ordinances, interpret statutes, things like that. But we don't have anyone tasked with kind of that legal representation aspect. I don't want to put Mr. Bankson on the spot, but he...
No, I would appreciate the opportunity to elaborate a little bit, if that's deemed helpful. The staff report refers to the appearance of a conflict, and it is because I don't, certainly under we as members of the Kansas Bar are governed by ethical rules. It's not a client-to-client sort of conflict, as is the greatest concern anytime you're dealing with a conflict issue. It has more to do, there are varying interests, I think, in this picture, and I'm sure Mr. Scragg and I, too, want to be careful and not to start venturing into the issues that the Planning Commission will be dealing with. But you do have the normal set of interests when you have a developer and when you have an adjoining set of property owners, as well as a different developer than the original developer of a kind of phased process. So as I sit here today, I can't tell you exactly what perceived conflicts could arise as the issues presented by the final plat are ultimately resolved. And again, I don't want to speak for Mr. Scragg, but I understood part of the concern to be, it was a concern of mine, if presented with a question by staff or the Planning Commission or the City Commission that required a formal legal opinion for us in the The final plat has just been filed. I understand Mr. Blanchard's point. There was a preliminary plat, but we now have a final plat. There are some distinctions. There have been some questions raised since the preliminary plat approval that I do think are part of the picture. Can't say as I know exactly what they will be, but I did not, or I was uncomfortable as we talked about it, having to sit here and say, well, goodness, I realize we've come to the city commission level, or here we are with the planning commission, and I'm sorry, I think you've raised an issue that I can't opine on because one of my partners has an interest, whether he believes it to be an interest of his or not. As you know, if folks don't like what they see or learn through a decision-making process, they can begin attributing all sorts of reasons as to why that outcome may have come about. And this is strictly in anticipation of trying to take that off the table so the process can go on as it should. No one would have a reason to suggest that any opinion received was influenced by the fact that we had a partner whose residence was in that picture. And in my mind, that's the justification. And it is more of a substitution, and certainly one of the factors is cost. I appreciated Ms. Butler proposed a rate of $200 per hour, which I thought was actually less than I expected. And I might explain also, obviously we have suggested a particular lawyer in a particular circumstance, but it was the unique combination. I know Ms. Butler strictly professionally. We both served on the City Attorneys Association board. We've both been presidents of the City Attorneys Association. I've worked with her. I know how much respect she commands among her peers. And we just happen to have the circumstance where she has just recently transitioned from having been Derby's city attorney for 9 years. So she knows the city side of the question. Oftentimes those with expertise in land use and development are understandably on the private side. She has the perspective of someone who has advised the same bodies that are involved in our process. And to Commissioner Longbind's point earlier, I appreciate, our firm appreciates the fact that the city looks locally for its legal counsel, and even if there's a necessity for counsel for a special appointment, we first look locally. In this case, I mean, one of the reasons that the conflicts check took a while to avoid the very situation we're trying to avoid here, we provided the names of all of the property owners in River Run addition, the phase one, as well as anyone associated with the proposed development. So that was a consideration. The availability, we were able to confirm. The credentials and what I believe you see there was the basis for believing that that was the expertise that was needed. And as I say, the cost and the scope of the services are laid out in the engagement letter. So that was the thinking, and that is what precipitated this seemingly unique circumstance of being able to suggest someone that had recent experience advising the same bodies that would be considering this final plat.
And that was particularly appealing to me in the basis for zeroing in on Ms. Butler and recommending her to you.
Okay, any other comments or questions from the
Dallas, Salina. I don't know why it's a big deal. $200 and some seems pretty reasonable to me because most attorneys that do this type of stuff are $500-600 an hour.
Any other comments? Okay, I'll bring it back to the commission for further discussion or a motion.
Mayor, I move we approve a motion authorizing the city manager to engage special counsel for the Overlook Estates platting matter.
Second.
We have a motion and a second to approve authorizing, the city manager to engage special counsel for the Overlook Estates platting matter. All those in favor? Aye. Opposed? That passes 5-0. That will lead us to development business.
7.1, approve ordinance number 23-11144 on first reading, annexing the east half of Centennial Road from Waterwell Road North to the existing city limits.
Mr. Andrew.
Thank you, Mayor and Commissioners. Back in 1988, the Salina City Commission approved an ordinance annexing the 80-acre Airport Industrial Center subdivision. That's property that's located at the northwest corner of Centennial Road and Waterwell Road. And at that time, the Saline County Commission contacted the city and requested that the city annex the entire roadway, meaning all of Centennial Road, into the city. In 1989, the city was contacted by the council for the property owner that owned property on the east side of Centennial Road, and they pointed out that there was a roadway easement and that their client owned to the center of Centennial Road and that they had not consented to have any part of their property annexed. So the City Commission then approved an amended annexation ordinance which removed the eastern portion of Centennial Road from the city limits. So since that time, the west half of Centennial Road has been in the city and the east half has been outside the city. Since that time, there was a statute that was passed in 2005 that dealt with annexation of roadways. And the city attorney interpreted that statute to apply only to those situations where the county actually holds actual right-of-way for a roadway and not a lesser interest such as a roadway easement. That interpretation was eventually upheld by the Kansas Court of Appeals, and then effective January 1, 2019, Saline County entered into an agreement with the city under which it agreed that it would not request annexation of roadways pursuant to that statute during the life of the agreement. So moving forward from that, annexation of roadways would be by consultation and negotiation. And in this particular case, the county has reached out and requested that we annex the east half of Centennial Road. The difference is this time in December of 2022, you authorized the city manager to execute the acceptance of a right-of-way deed for Centennial Road. So by virtue of that deed, the city is now the owner of that strip of right-of-way, and this action today would annex that into the city. The impact of annexing it into the city would mean that the city would take on full maintenance responsibility for that half mile of additional roadway, including a new hike-bike path, mowing and maintenance of roadside ditches. The county has indicated that upon annexation, they have agreed to pay the city $200,000, which would reduce the city's local match on the project from $400,000 to $200,000. So we've identified 3 options for you. You could approve the attached ordinance on first reading. That would annex this strip of roadway, essentially the east half of Centennial Road, into the city limits and bring it under the city's full jurisdiction. You could postpone consideration of this request to a future meeting date to allow staff to provide you with additional information, or you could decline to approve the attached ordinance, which would leave the city limits where they are and leave the east half outside the city limits. Our recommendation is that in accordance with the County Commission's request, our recommendation would be to approve the attached annexation ordinance on first reading. I'd be happy to address any questions.
Any questions from the commission?
No. Nope.
Okay. Any comments or questions from the public? Okay, with that, I will bring it back to the commission for action.
Mayor, I move we approve ordinance number 23-11144 on first reading, annexing this strip of road right-of-way into the city. This would bring all of Centennial Road under the administration, regulatory, and law enforcement jurisdiction of the city.
Second that.
We have a motion and a second to approve ordinance number 23-11144 on first reading, annexing this strip of road right-of-way into the city. All those in favor? Aye. Opposed? That passes 5-0. Mr. Andrew, I believe you're back up again.
Item 7.2, approve resolution number 23-8113, allowing the construction of an enclosed walkway over a public utility easement that would connect a new freezer building with the new west building at the Tony's Pizza Plant site at 1701 West Schilling Road.
Thank you, Mayor and Commissioners. This is a request that comes from Burns and McDonnell, which is the designers working for Schwann's on the design of a new freezer building that's being proposed on the Schwann's campus. Since 1991, the city has had an ordinance in the zoning regulations that prohibits the construction or placement of any building or structure that requires a permit in a platted or recorded public utility easement unless that is expressly authorized by the Board of Commissioners. So staff has identified that the design plans presented by Burns McDonald proposes an enclosed walkway between a low bay portion of their new freezer building and the new plant building that is nearing completion. As proposed, this walkway would be built across 25-foot and 25-foot utility easements that span this block. And so Burns and McDonnell, on behalf of Schwann's, is requesting that the commission authorize this easement encroachment. And of course, the purpose of having this review is to make sure that all the utilities are notified and they have an opportunity to comment on the request to avoid any relocation costs or unnecessary damage to their facilities. In this case, we do not have any public water lines in this area. Evergy has relocated all of their utilities out of there. The only utility that has anything left is Kansas Gas, and then they have indicated to staff that they do not object to the location or placement of the walkway. They've just requested that Burns McDonnell work with them on protective measures and potential line relocation options. So we received no formal objections to this connecting tunnel, or more properly a covered walkway. Did want to indicate that the one that's farther north is 10 feet wide and about 35 feet long. This one is 28 feet wide and 194 feet long and will have be used a lot by automated vehicles that will go between the two spaces. We have suggested in reviewing this some possible findings on page 3 and 4 of your report. Those findings have been incorporated into the easement, and we think it's important to make those findings so that this can be distinguished from any future requests that might come forward. So we have prepared a resolution for your consideration, and you could approve that resolution to authorize the placement of the enclosed walkway over the platted utility easements in Tony subdivision. You could postpone consideration of this request if you feel like you need additional information to reach a decision, or you want to have modifications made to the resolution, or you could decline to approve the attached resolution and provide further direction to staff. So we've provided you with some exhibits and drawings in your packet, and I think those show what this walkway looks like and where it is located. And this is primarily a function that at one time Scanlon Avenue ran between Arnold Avenue and Schilling, and there were quite a few utilities installed along Scanlon. Scanlon has been removed, but a lot of those utilities still exist.
Okay, I'll look to my left. Any questions or comments for Mr. Andrew? All right. Okay, any questions or comments from the public? Okay.
Developer online.
What's that? Oh, is there?
Yeah, I think Jeff Thompson is with Schwann's, but I don't want to put him on the spot and have him comment if he doesn't feel like he needs to.
Just
No,
I have no further comment.
Okay. Thank you. And just to be clear, if there was work that needed to be done to the utilities located underneath the walkway, the resolution gives the utility company the ability to go in there and work on those, and any damage or cost to the walkway becomes the expense of Schwann's, correct?
Correct.
Okay.
Because the easements are still there and because the utilities have a right to be there, the goal is to have Burns McDonald coordinating with those. Some have, as Evergy, seeing this was coming, relocated their facilities out of there. Others, like Kansas Gas, may work to have protective sleeves, but in the easement, the rights of the utility holder
And I think that's
comes first.
Important for everyone to understand, so thank you. Okay, with that, I will bring it back to the commission for a motion.
Mayor, I move approval of Resolution 23-8113.
Second.
We have a first and a second approving resolution number 23-8113 to authorize the placement of a 28-foot wide enclosed walkway over a 20-foot and 25-foot platted utility easement in the Tony's subdivision. All those in favor? Aye. Opposed? That passes 5-0. That will bring us to item 7.3.
Item 7.3, approve ordinance number 23-11143 on first reading, amending section 42-362 of the I-2 district regulations and section 42-382 of the I-3 district regulations to add storage of consumer fireworks to the list of permitted uses in the I-2 and I-3 zoning districts.
Okay, Mr. Andrew.
Thank you, Mayor and Commissioners. In 2011, the City Commission adopted an ordinance that authorized the sale and use of fireworks, but the sale and use of fireworks was limited to what is known as fireworks 1.4G, or what is known as consumer grade fireworks. It did not include what is considered fireworks classification 1.3G, which are large fireworks devices which are used in fireworks displays. And so the process set up a ability for those wishing to sell consumer fireworks to get a temporary use permit and set up temporary stands around the city. That text amendment dealt with stands and temporary storage at those stands, but did not address permanent storage. In the fall of this year, Jerry Helmer, on behalf of his client Chris Helm, approached planning staff about the potential of constructing a fireworks storage facility within the city of Salina. Planning staff researched our ordinance and informed Mr. Helmer that only I-3 heavy industrial district would allow explosive storage, including fireworks, and that it only was allowed as a conditional use. And so under the zoning ordinance did not differentiate between consumer fireworks, which are not deemed to be explosives, and
professional grade fireworks, which are deemed to be explosives. So following that, we set up a meeting, and we had a meeting involving planning staff, the interim building official, Sean Homan, the fire marshal, Troy Long, to discuss that storage. And as part of preparing for that meeting, the building official and fire marshal determined that the building code and fire code differentiated between consumer fireworks and display grade fireworks, that the building code and fire code did not require any special construction provisions for consumer grade fireworks storage, as long as there were no other explosives stored at that facility. And from that, Mr. Helmer concluded that if the building code and fire code both treat consumer fireworks separate from display grade fireworks, that he believed the zoning ordinance should also. So following that meeting, a text amendment application was filed to amend the zoning ordinance to allow consumer grade fireworks storage facilities as a permitted use in both the I-2 and I-3 district, similar to other storage buildings and warehouses. And so that item was scheduled for a public hearing on January 17th. Due to a lack of a quorum, that meeting was rescheduled to the 31st. And at that meeting, Mr. Long was present, the building official, Mr. Homan, was present, or actually Mr. Kovacic was present on behalf of the fire department. And so the Planning Commission conducted a public hearing on that and determined that because the building code and the fire code treat consumer grade fireworks and display grade fireworks differently from a regulatory standpoint, they felt the zoning ordinance should also distinguish between the two, and they recommended approval of the text amendment, which is before you today. And so that text amendment would allow on I-2 or I-3 zone property to have a consumer fireworks storage building subject to the separation requirements that are currently in the code for fireworks facilities. And so rather than just what would be a purely permitted use, it would be what planners would call a provisional use. You can have it provided that you're a certain distance away from other uses. So today, if you want to have a consumer fireworks stand, it has to be at least 300 feet from any residential zoned area. And under this text amendment, a storage facility would have to be at least 300 feet from any residential area. And if you want to have a fireworks stand, it has to be at least 300 feet from any type of fueling facility. And this text amendment would require that any storage facility be at least 300 feet from that facility. But the main educational piece, I think, for the planning staff, for the planning commissioners, was that our building and fire codes already treat consumer fireworks differently than professional grade fireworks, and that consumer grade fireworks do not fit within the classification of explosives. And since the zoning ordinance treated all fireworks storage as if it was explosives, this change would differentiate the two, but would maintain the requirement that if you want to have storage of explosives, that is only allowed through a conditional use and only allowed in the I-3 district. So we do have Mr. Long, the fire marshal, here. We also have Sean Homan, the acting building official, here, if you have building code or fire code related questions. But this is coming to you with a recommendation for approval. And we did want to point out again that all the separation requirements that apply to stands, the Planning Commission recommended apply to storage facilities.
And the applicant, Mr. Helmer, are here as well.
Yes.
Okay, any questions for Mr. Andrew? Okay. Would the applicant like to make any comment, or Mr. Helmer?
Chair, members, thank you. I would first like to thank our city manager, Mr. Schrag, when we first addressed this issue.
I'm sorry, could you give us your name,
A little
please?
closer to the microphone.
Could it?
I seem to tell people that in my room, too. Thank you, Mike. I'd like to first thank our city manager. When I first addressed this matter, he gave a suggestion of how we move down this path, and Margie Clem was very helpful in assisting in this matter. Then with the fire marshal and with Dean and with Sean and other members, we actually were better educated on what we were asking to have happen. And this seems to be a very appropriate opportunity for us to have the differential in the term explosive. When one thinks of fireworks, one of course thinks explosions. That's the purpose of buying a firework. To be safe for the community, we've now believed that we have now brought in the opportunity for the codes to be consistent and also for the safety of the community, because we're now going to be complying with all the other regulations. Fire departments will know exactly where items are, what they are. They're subject to inspection. We will not be engaged in anything other than consumers, so we will not be engaging in explosive type material. The fire marshal shared with us that in his review of information, these types of products that are stored do not explode. They will smolder and they will create some significant opportunities to put out fire, but they're not the danger that we expect when we talk about an explosion and we expect to have a fire cloud and danger to surrounding properties. So we would ask the commission to favorably consider the differentiation change so that we can bring this about and keep things consistent and allow this to proceed with this matter. If there's questions, we'd be happy to try to address them.
And for the record, a lot of us know who you are, but could we get your name? I'm sorry.
Jerry Helmer. I am counsel for Mr. Helm, who's the applicant in this matter. Thank you.
Thank you. Any questions for Mr. Helmer? Okay. Thank you for your time. Are there any comments or questions from the public?
I would kind of like to hear the fire department's thoughts on this. I know they put a lot of work into it, and they're set through this long meeting.
Troy Long, Fire Marshal with the Salina Fire Department. Thanks for the opportunity to address you, gentlemen. For me, it really came down to what the code says. And 1.4G fireworks are regulated by hazardous materials, and anything above that is regulated by the ATF. Our code's very specific in spelling that out. Just as an example here, the term explosive includes any material determined to be within the scope of the USC Title 18, Chapter 40, and also includes any material classified as an explosive other than consumer fireworks 1.4G by the hazardous materials regulation. And then you go back to the specific definition of fireworks, and you look at 1.4G, and it gives a description: small fireworks device containing restricted amounts of pyrotechnic composition designed primarily to produce visual and audible effects by combustion. Such 1.4G fireworks which comply with the construction, chemical composition, and labeling regulations of DOT-N for fireworks UN 0336 and the U.S. Consumer Product Safety Commission as set forth in CPS C16 CFR Part 1550 and 1507. The most important part of that whole thing is at the end. It says are not explosive materials for the purpose of this code. So for me, it was just the intent of getting our code to be parallel with the zoning code.
Question, are the fire, I don't know what to call them now, but the chemicals that propel the fireworks 150 feet up in the air, are those considered explosives? Because I'm assuming a certain amount of explosive force is required to shoot that thing out of the tunnel and
so
up that high.
Part of that comes back to the when they test material as it sets in packaging. 1.3 and above explosives, it starts at 1.1 and goes all the way down through 1.4. 1.1 through 1.3 all have the ability to send basically shrapnel when the package burns. When you look at 1.4, the history and the studies that they've done on that just show that that package just burns and doesn't actually explode. So that's where I think where the difference comes in. Yes, there is an explosive, it's black powder, but it's below the amount that is regulated by the ATF.
So, and correct me if I'm wrong, but the classification system that Mr. Long's describing takes into account all of that. There is a federal classification system of all those fireworks that you're able to buy at a fireworks stand, accounting for how they get in the air, what their display is once they go off. And so the fire code and the federal provisions are already taking that all into account, separate and distinct from anything we might do locally. So if they're 1.4G, it's factoring in the different chemicals, all the elements that go into that item.
And I do appreciate what you say. Because we're building a house, we've been in Salina for the past couple months, and we've got a neighbor across the way that 2 o'clock in the morning, you hear this boom, and it's like, well, of course my wife freaks out, but it's a loud boom, and it does shoot something up in the air.
Which in my simple way of looking at it invokes the phrase explosion, or even if it's a controlled explosion. Have there been, and you said that buildings like this, should they catch on fire, do not explode, they just...
They just burn. Just like it's no more of a flammable hazard than having a warehouse full of paper or something like that. We have far worse places in Salina than what we could have here. I mean, we have a place just down the street from the fire station that could wipe out the entire elementary school. So that's got horrible gases in it that are allowed in that occupancy. So, yeah. Fortunately, if he does this building, we're still looking at being like an H3 occupancy type, which would require the sprinkler system, the notification, all that stuff. So we get early notification as well.
All right.
Yeah, that was my next comment about the sprinkling, so thank you.
Yeah.
I have one question for Mr. Andrew.
And I think the real advantage to this is having a specific building specifically for this, and you guys know where it's at and what's in it. So
yes, yeah.
I appreciate the applicant going through this whole process.
I just have one question for Mr. Andrew. Okay. On page 2 of the blue sheet, that last paragraph, the big paragraph at the bottom, stated Mr. Helm preferred to have the storage of fireworks be a permitted use instead of a conditional use for financing purposes. And then 2 sentences down, planning staff noted that the storage of explosives was a conditional use rather than a permitted use because of the potential impact it could have on the surrounding properties. Is the Planning Commission abandoning that stance?
That was our stance before we had the educational meeting with Mr. Long and Mr. Holman. So that was, we were trying to explain why the current zoning ordinance treats all fireworks as explosives and why that was a conditional use. That was our statement at the meeting before we got educated on the building and fire code by Fire Marshal Long and Mr. Holman.
Okay, so is it abandoning the thought that it could have a potential impact on the surrounding properties?
Yes. Once it was explained to us by Mr. Long that 1.4G did not have explosive properties and it wasn't technically correct to classify 1.4G fireworks as explosives, we do not see where, as Mr. Long indicated, where the storage of fireworks would have any more impact on a neighboring property than the storage of some other materials if you had a warehouse or storage building. So that comment there reflected our attempted explanation to Mr. Helmer and Mr. Helm as to why currently the code treats it as a conditional use, but now that we have been educated about our building and fire codes, we don't think that distinction is justified.
Okay, thank you.
Okay, no more comments. I'll bring it back to the commission for action.
I move the city commission approve the proposed text amendment as drafted and presented, and approve ordinance number 23-11143 on first reading.
Second.
We have a motion and a second to approve the proposed text amendment as drafted and presented, and approve ordinance number 23-11143 on first reading. All those in favor?
Aye.
Opposed? That passes 5-0. Thank you very much for everyone's input on that. Other business. I looked at other commissioners.
And for me.
Beautiful day out here in January, and I just wanted to point out that the tennis complex, their long, drawn-out process, opened today. So, I don't know where Mr. Winholtz is. I guess he must be out playing around.
Tennis.
Well, I happened to leave the Rotary meeting, and looked like K-Dub was there over lunch, so it's already been in use.
Mr. Winholtz wasn't playing. I didn't see him.
Well, maybe he took it up.
One of the things that was in the legislative update, and I've talked to Mr. Scragg about, is you might have noticed that originally the state was looking to phase in the reduction of sales tax on food items.
State.
Who did I say?
No, I'm sorry, I'm trying to clarify. They were phasing in just the state.
Yeah, the
portion of
state.
that.
And the Senate just last week passed doing away with the phase-in and go to 100%. And it also now included local sales tax on food that was new. So asked city staff to look into that, and we're trying to anticipate, if that was to happen, what that would do to our sales tax receipts.
And you may recall from prior conversations that the different retailers self-declare whether they're a grocery store or a department store, and so we have quite a few retailers that are a combination of things that don't clearly break along those lines. And we have things that you might, take Walmart, Sam's Club, Target, they could declare themselves at their discretion one way or the other. So staff has previously run this exercise. We're doing it again to look at our best estimates of sales tax revenue. There was some information that Debbie Pack found from a year or two prior where I think the state of Kansas indicated they thought 15% of sales at some of those combined retailers were food related. Then another factor, as you know, is not only do we get the city sales tax, but we get a partial distribution of the county sales tax. And so first pass, it's probably over $2 million is our estimate, and which puts it in the equivalent to about $4 million of property tax levy. And that may be understating it from both the all-inclusive nature of other retailers that sell food as well as the county. So we're still trying to refine that number. The other thing that got my attention is some of the press coverage really described it as it started out as a conversation about a flat income tax, and this may be a tactic in terms of negotiating to some kind of middle ground. But as it currently stands, it passed the Senate. It's headed to the House Taxation Committee, and we'll prepare our estimates. We'll look at the timeline, and one way or the other, we will double back to you as a governing body just to make sure that before we advocate a position that's consistent where you're coming from.
Just one follow-up question. And I'm asking out of ignorance, does that tax apply to food that's either carried out or in restaurants?
No.
Those would still be taxed.
Right. The restaurant activity would still be taxed. As I read the news coverage, it looked like there was some proposal that it would remove the sales tax on healthy food at a grocery store as opposed to unhealthy, and that didn't survive. But the reason I bring that up is it does look like this is an evolving conversation on the fly, on the floor, So that's, as
So-
I
so you
understand
may-
it, at the
you
moment.
may-
Fast food, as it's commonly known, would still be taxed.
Right.
Yeah,
Right.
and we're not sure, depending on how this comes out, you know, your Doritos and your Ding Dongs may be taxed still. We don't know, so so they're still working through that. But I just wanted the commission to be aware of that, so that city staff is reviewing that, so we'll at least know if we want to, as a commission, take a stance that we can. So, okay, any other business from any of the other commissioners? Okay, if not, that brings us to Citizens Forum. This is an opportunity for individuals to bring before us any item that was not on the agenda, and we ask that you keep your comments to 3 minutes.
Norman Mantle, Salina. When are we going to schedule another meeting addressing the homeless issue? Because in about 3 or 4 months, we're going to have warm weather. They're coming here.
Thank you.
Good afternoon, John Blanchard. First of all, I'd like to thank you, Greg, for your explanation of that. You had me at appearance of conflict of interest. I'm sure you've all read the news and heard the news about the GDP growth in Saline County and the news of population growth in Saline County. While some of the numbers look really good, I think we got to be careful what numbers we use. Like with the GDP, we got to make sure we're using inflation-corrected dollars instead of just current dollars. So what I was able to find is that we still had really good inflation-adjusted GDP growth of about 4.24%. So that's really good. And I'll bring this up with county commissioners. This is not something you guys typically deal with. But I will ask you this, because we have from time to time said we believe the census data, we don't believe the census data. Are we kind of all on board now that we believe census data? Would it be fair to say we're pretty trustful of census data? Okay. Well, you had mentioned that you had mentioned on a radio interview that we had a 207 population growth, and that it looks like things were moving in the right direction. If that's fair, they paraphrased you. I'm paraphrasing them. Okay. There's a small problem with that. Is that if you go to the Census Bureau right now and you look at the population change between 2020 and 2021, we didn't gain 207 residents, we lost 387. And so I know where the chamber made their mistake in the analysis of the data. I can explain that to you, but you probably are not interested. But I will just say this. When you use census data, you have to use data sets that are vintaged together. You can't mix and match, and you can't analyze population growth from the certified Kansas population, because the current year is correct, but the prior 2 years have not been properly adjusted, which is what the Census Bureau does to come up with their number. So I will get that information to Mr. Scragg. But if any of you want it, I'll send it to you individually. But I'll send that to Mr. Scragg. But I just want to say that I also heard that you were mentioning caution on making sure we don't build too many units. I hope that when we think about how many numbers of units we're going to build, that we mesh that with the proper census numbers and the proper data for the population. I'm sure Ms. Driscoll is aware of the census data. So thank you, guys.
Yeah, thank you. Okay, anyone else?
Jerry Ivy, Salina, Kansas. I'm here to inquire about the pond at Jerry Ivy Park. There was on social media there was a survey that came out I saw over the weekend naming all the options of how they wanted it built. The main option that was left out was rebuilding it in the fashion that it's in now. Per your study session at the end of December or beginning of December, there was actually a plan within that saying how it could be rebuilt and done properly and get it to last and look similar to what it does now. A lot of people I've talked to say that they would like it to see it the same and not change to something else. So I guess I'm just wanting to know why that wasn't an option on the survey.
Was this our survey?
Yeah, it was through the Parks Department and the consultant that we're using on the design. I guess the short and direct answer to that is that the study session that you're referring to went through those options. The conclusion of that, part of the detail in that study session was what are the contributing factors to the pond being in the condition that it's in, what's the future, what would have to be built and what maintenance would need to be involved. I've taken to referring to the pond in its current configuration as a petri dish. That's why we have so much green algae. And the study session went into that in detail in terms of the light getting all the way to the bottom to grow moss. So the conclusion coming out of that study session was that we should pursue other water features other than a pond. So
there was a study done or a survey done in 21. Were the results ever released on that?
Yeah, in fact, that was shared with the City Commission, and that was part of the conversation in subsequent study sessions. And my comment, staff's comment at the time was that survey was done before we had identified the cause of the problem and the solution. So it was much more open-ended on a presumption that just put the pond back. When we brought in a consultant to help us figure out what was the cause of the problem and if we wanted to maintain a pond, what that would look like, that led to the direction that we received more recently.
But the option at the end of that study session of that report said if they were to dig that out to 10 feet, rebuild the walls and put in an aeration system, that then would be a feasible pond and it would eliminate the algae and all the problems that you're having with it.
But you need to look at the study session in context. That was all information for the governing body's consideration. And then after considering all that, they provided direction on how they'd like us to proceed.
But you're taking the citizens' input, but you're leaving out that part that is an option.
Well, there's been multiple rounds of citizen input, and part of it is a cost consideration, but
one of the options on the survey was greater than $1,200,000. So I don't think it's going to cost more than that. Whatever you guys decide, I get it, and whatever the citizens want to see, I get it. But to leave that option completely off the table when I feel like it is an option, just doesn't seem right. So thank you.
Thank you.
Is there a time frame on when that survey will be complete and we'll have the results?
I don't know off the top of my head. I remember looking at it over the weekend, but I don't remember if there's a deadline
I think
for
they're going
it.
to leave it out for a few weeks.
And but there's already been given direction to the city staff as to what we perceive happening now, correct?
Yeah, you broke that into two steps. One was fill in the pond, the other was pursue alternatives to a pond.
After it's filled in, right?
Correct.
Yeah.
So, frankly, Mr. Ivy's concern is revisiting that prior direction.
So the decision has been made to fill the pond in as it is, and then the survey that you're referring to is if there's a water feature, what will that look like? And so that's probably maybe a little bit what's confusing about the new questionnaire that's out there. And speaking of that, as I was driving by it the other day, do you know when that's to happen as far as the draining of the pond and
so the design, right now we have the firm that did the survey is doing the consulting on the design for filling the pond in. I'm hoping that we have something in the next 14 days that we can submit out to the public for a bid to get that work done.
Because I know we're wanting, I'm not sure the blue-green algae has ever gone away.
Yeah, they're real close to being done on the design consulting part of that. We'll send an RFP.
The other thing is I noticed that the ducks and the geese that had been missing, or some of those are back. So that's only going to.
It lasted for quite a while.
It
longer than I
did.
expected,
But I did
but-
notice that some of them have returned. So we'll be fighting that same issue that we have in the past. So, okay.
Rosemary Mai from Salina, Kansas. The Granny Brigade is conducting a water drive for the East Palestine community in Ohio, and we have partnership with Long MacArthur and Doug Bradley Trucking. Long MacArthur has been a drop-off point for us, and Doug Bradley's Trucking is going to transport the water to Palestine on a week from today. And so we're asking the community to help support us into getting water to Palestine. Long MacArthur will be collecting water until Friday, and the Granny Brigade members will be out at Doug Bradley's warehouse Thursday from 9 to 5 and Saturday from 9 to 5, and that's 246 East Berg Street.
And is that to collect water or to collect donations?
Well,
Or
it's both, but we prefer the water because there's only a few of us that are running around getting water. And we started this Wednesday, and I contacted a couple of churches and a community there in Palestine, and this is about the time they're going to need more water, and that's the reason why we've got a short period to collect it. And we started Wednesday, and as of Saturday morning, Long MacArthur had a good showroom of water and $1,000 worth of donations. So 5 of us ran around Friday and Saturday getting water and getting it over to Long MacArthur. But preferably the water, and like I said, if you want to bring it to the warehouse, we will be there on Thursday and Saturday.
Okay, and give those times again.
9 to 5,
9 to
and it's
5.
246 East Berg Street, and we will have American flags lining up the route from 9th Street to the...
So they can find it.
So they won't have any problems finding
Okay.
us. And we want to thank the community that has stepped up already and helped us, because we have gotten some corporations, some small businesses already donated, so.
For those of us who may not be up to date on the why behind this, could you just give
The train derailment with the chemicals that were in it contaminated their water. And I've spoken to a few residents there, and they still are afraid to drink the water. They say the government says it's okay, but they are a little leery about that. So we want to help what all we can.
Okay, thank you for your efforts.
And before we leave, we have a big card that we would like for you, the commissioners and mayor, to sign to send along with our water to let the people in Palestine know that our community is behind them.
Thank you for
Thank
your
you.
work. Okay, anyone else? If not, I'll accept a motion to adjourn.
So moved.
Second.
We have a motion and a second. All those in favor?
Aye.
Opposed? We are adjourned. Thank you.